Major funding for On Point is provided by Liberty Mutual for all your auto, home, life, and business insurance needs. Liberty Mutual. Responsibility. What's your policy?
On Tuesday, the Republican chairman of the House Budget Committee, Paul Ryan, said the way to bring down the costs of Medicare, Medicaid, is of covering the medical bills of the country is the time-honored way: privatization, competition.
That gives consumers, seniors, choice. It has insurers competing against each other for their business. We want to harness the power of patient choice, of competition.
In Medicare. In Medicaid, it's basically a block grant going to the states. Here's how Paul Ryan spoke of it.
This budget proposes an end to the one-size-fits-all approach. It converts Medicaid into a block grant and cuts the excessive federal strings, freeing states to design programs that work best for their residents. Giving states more flexibility will allow them to create a range of options that will give Medicaid patients access to better care.
There's the message. A big, big change in both these programs on the table now. And with us as well today, Jonathan Oberlander joins us from Gainesville, Florida. He's professor of social medicine and health policy and management at the University of North Carolina at Chapel Hill, author of The Political Life of Medicare. Jonathan Oberlander, welcome to you as well.
Thanks so much.
Jonathan, let me come first to you. What do you see on the table here? Pros, cons? What's your basic take on what Americans are being offered?
I've been studying health policy for about 25 years, and I was stunned when I read this proposal. I really believe this is the worst health plan I have seen in my 25 years in the field. I think it is reckless policy. I think it is politically unworkable, and frankly, I think it's morally repugnant. It would absolutely devastate Medicaid and erode the almost 50-year promise that Medicare has had for our seniors.
Why reckless? Paul Ryan says we're on a reckless path right now, that the country will be bankrupted if we don't do something, and here he says is a way to go.
Well, he wants to cut $750 billion over 10 years in Medicaid. The Congressional Budget Office estimates that that would slash federal spending on Medicaid by 50%. That's 50. And we have to remember who's on Medicaid. It's children make up about half of it, pregnant women, the disabled, seniors, people with HIV/AIDS. So what essentially Congressman Ryan is proposing is to take the most vulnerable part of our society and absolutely obliterate their health care coverage. If you look at his proposal for Medicare, this would substantially shift costs to Medicare beneficiaries to the point where they would be paying about two-thirds of the cost themselves.
But what about his fundamental argument that we can't afford to keep doing what we've been doing, that here you maybe have to be cruel to be kind, otherwise the whole country goes bankrupt?
Well, I would frankly take his argument a little more seriously if in the same budget proposal he was not proposing to extend the Bush tax cuts for upper-income Americans, which is going to cost about $700 billion over 10 years. So on the one hand, he's saying we can't afford to have health insurance for the most vulnerable citizens in our country. On the other hand, he's saying we can't afford to extend tax cuts for the most fortunate citizens. This just does not add up, even as budget policy. Well, first of all, the Ryan proposal is not going to expand choices. The way that Medicare works right now, beneficiaries can choose from the traditional program or a private insurance alternative. What the Ryan proposal would do is take away traditional Medicare as an option. So it actually, in a very important way, would restrict the choices that Medicare beneficiaries have. I would really encourage all your listeners to go to the Congressional Budget Office website and read their analysis of the Ryan proposal. The Congressional Budget Office is nonpartisan, and as Gail can attest, both parties hate them, depending on the time, which is good proof that they're nonpartisan. And they looked at the Ryan proposal, and what they said is that traditional Medicare, given all the limitations that it has, is cheaper than private insurance. It's cheaper by about 11% today, and by 2030, they estimate it will be 30% less expensive than private insurance. So it's not just that Congressman Ryan wants to shift the burden of rising health care costs to seniors and disabled beneficiaries of Medicare, which he does. It's that his proposal would actually exacerbate health care spending. It would increase health care spending by going from a less expensive government option to a more expensive private option.
Is there a Democratic option then to deal with the fiscal problems that that this is one path. This is Paul Ryan's path of getting at them. Would President Obama's reforms begin to do this, or are the Democrats missing at this point from that conversation, Jonathan?
Well, when you talk about reducing the deficit, there's fiscal policy and tax policy. And in terms of the long-term deficit, I agree with Gail. When you're talking about controlling long-term deficit growth in the United States, it really is about health care spending. But Congressman Ryan wants to repeal the Affordable Care Act, which actually, according to the Congressional Budget Office, does quite a bit to control health care spending in the long run. So I think what the Obama administration would say is that we have, as part of the Affordable Care Act, these experiments in delivery system reform to get that more integrated care that Gail was alluding to, experiments in payment reform, and we want to scale those up and see how those work. Now, you can be skeptical, and certainly I am, about whether those are going to work in the short term, but I really think if you're going to give private insurers an exclusive monopoly on Medicare, which is what Congressman Ryan is talking about, you're taking a big step back in cost control. And in addition, he wants to repeal one of the more significant cost control instruments that was part of that law for Medicare, which was the Independent Payment Advisory Board, which was going to have the ability to recommend to Congress changes in Medicare payment.
Would the exchange, the board overseeing this new exchange of private companies have the same kind of power? Jonathan, could it provide the same kind of role by looking at the kind of policies that the government will offer premium support for?
We don't know the details. He says in his proposal that he would give Medicare beneficiaries a list of options, which I don't think is going to be tremendous consolation. And there's sort of a disconnect. Gail was talking about people being consumers. Let's think about the Medicare population here for a second. There are many very sophisticated consumers of medical care in the Medicare population, but about 30% of the Medicare population has cognitive limitations. And the idea that they're going to go around and shop among lots and lots of healthcare plans to make exactly the right choice, I think really is a fantasy. So this is, at the end of the day, this proposal for Medicare, in my view, is not about budget savings. It's really about ideology, and an ideology that Congressman Ryan has, that privatization is the answer.